Vanakkam, Namaste and welcome to Dr. Shah's Clinic. In this video, we are going to answer the question, what age does erectile dysfunction begin? So, if a man is unable to sustain his erection or is unable to attain erection for adequate sexual intercourse or adequate satisfactory sexual intercourse, the man or the individual is diagnosed with a condition called erectile dysfunction. Now, not much was actually known, about this particular condition. It's only the early or late 90s to the early part of the 20th century that, much information has actually, come about this particular condition called erectile dysfunction. We now know that a man's erection is an excellent marker of his overall general health status. And it's not just that, we know one thing for sure, a large proportion of men who develop erectile dysfunction will have some underlying vascular abnormality or a vascular pathological process. So what we know for sure is that, all men at some point of time in their life will develop erectile dysfunction. And at what age does it normally begin? What we are looking at today is a large number of patients, up to 30, maybe even 35% of patients developing erectile dysfunction at ages that are, in the age group anywhere between 25 to 35 or even 45 years of age. Now, usually before, we were looking at a trend where erectile dysfunction was seen in much older men, in men who are over 45 years of age, over 40 years of age, and usually 40 years and above. But today, complete drastic shift in the demographics of the patient population, and today we are seeing many, many young individuals, almost 1 in 4 men. In fact, there was a paper that came in the Journal of Sexual Medicine which kind of, came out with the data stating that almost 1 in 4 men who are less than 40 have actually some form of erection disorder or the other. And this is probably, we are detecting erectile dysfunction in younger individuals because of better testing, more objective assessment of condition. We now use standardized scales like the IIEF questionnaires to assess erectile function. We also know that erectile dysfunction is associated with diabetes, hypertension, cholesterol, obesity, metabolic syndrome, as well as certain unhealthy lifestyle habits like cigarette smoking, excess alcohol intake, disturbed sleep pattern, and we are also detecting testosterone deficits. So a lot of things are actually happening, as far as erectile dysfunction is concerned. So all said and done, the oldest study on the epidemiology of erectile dysfunction was the Massachusetts male aging study. It's called the MMAS study, which actually looked at the incidence of erectile dysfunction in a cohort of 1,709 men. So you can look it up on Google. The MMAS study is a very popular study. And the study actually noted that about 8% of men in the age group of say 40 to 49 will have moderate erectile dysfunction, and almost 40% of men in the age group of say 50 years and above, almost 40% of men are going to have erectile dysfunction. And when we look at the Indian data, although we don't have very large scale studies with respect to large scale cohort studies like the MMA study in the Indian data, what we are looking at, I can share with you data that from my own clinic. So what I'm looking at over here in the clinic is, we are seeing a large proportion of young men who come to the clinic with erectile dysfunction, predominantly within 35 years of age. Almost 1 in 4 men, just like, as revealed in the publication, the scientific literature, we are looking at a similar instance even in India. And in India, we are looking at erectile dysfunction in young men from a variety of reasons, because today there's a drastic change in the lifestyle habits: cigarette smoke, excess alcohol intake, unstable partner relationship, drug abuse, and disturbed sleep-wake cycles, numerous psychogenic factors, financial stress. So there are a lot of reasons that are leading to erectile dysfunction in young men today, and in older men also, because we have a sizable number of people who are in the aging population, the geriatric age group. We are looking at an increased incidence of erectile dysfunction. Almost 40 to 50% of men who are above 40 will have erectile dysfunction. Definitely, at least in our Indian subpopulation, that's a rough estimate, and especially of men who are over 40. So as you can clearly see, erectile dysfunction is going to be a global public health problem world over, because it affects the older individual, also affects the younger individual. Although it's more predominant in older individuals, we are seeing a trend where young men are going to be affected. I hope you found this video particularly informative. Please share this video with all your friends and loved ones. Like, comment and subscribe. Please feel free to reach out to me for any more questions that you may have. This is Dr. Shah. Vanakkam. I'll see you back soon with